And we're very pleased to introduce next Dr. Keith Marsolo. Dr. Marsolo is an associate professor in the Department of Population Health Sciences and a member of the Duke Clinical Research Institute. We'll be talking about initial efforts towards the characterization of the COVID-19 population in PCORnet. Dr. Marsolo?
Great, thanks, Shelley. Can you hear me and see my slides?
Yes, to both.
Okay, great. Thank you so much. So I'll talk about some of the work that we're doing in PCORnet. So PCORnet is a network of networks, and so it's made of clinical research networks, which are composed of academic medical centers, health systems, federally qualified health centers, things of that nature, health plan research networks, which are a couple of private payers, patient partners, and then a coordinating center that includes ECRI, Harvard Pilgrim Healthcare, and then Academy Health. And so all that together makes up PCORnet. The map that you see on the left is an indication of where the data contributing sites within PCORnet are clustered, and there's around 70 or so that have the potential to contribute data. So PCORnet, in contrast to what Warren was just talking about, so PCORnet operates in a distributed model where the data remain local at the sites. It's harmonized into a common data model. It goes through a quality assessment process, but then queries are distributed from the coordinating center to the sites. They download the code, they run it locally, and then they return the results back to the coordinating center where they're aggregated and then passed on to the requester. So a little bit different from the centralized model that Warren was referencing. So, you know, as it became clear that this was going to be a crisis with COVID, you know, it became a question of like, well, how can we use the PCORnet infrastructure to support surveillance and research? And so, you know, one of the first questions that was asked was, you know, the PCORnet common data model, is it sufficient to handle most of the core data elements that you would need for COVID-19 research and surveillance? And the answer to that question was yes. There's a home for, you know, sort of everything that's being tossed around as a, at least right now, as an important factor that you'd want to do on sort of basic COVID research. So there's a place for it. May not have been loaded, because, you know, nobody's been interested in it yet, so there's some effort that might have to go in there. But that was sort of the first step. The second issue that we faced is that the current expectations within PCORnet, our partners, they refresh their data every quarter, and then, as I mentioned, they run a data quality assessment. And so, you know, we refresh January, April, July, and October, and then once the data are refreshed and go through this quality assessment, you know, you're looking at about a 1 to 3 month lag in the information. So then, you know, if we wanted to do more rapid characterization of the population, is there a way that we can stand up a version of the data model that allow for more up-to-date information? And so, you know, what we came up with was essentially this parallel process that we would instantiate, where we asked partners to create a rapidly refreshed standalone version of the CDM. And so the inclusion criteria that we came up with was, you know, sort of coronavirus patients. So that would be, you know, anybody that was positive, anybody that had a test at all, whether it was positive or negative. So again, like you saw in N3C. And then we actually expanded that to include other respiratory illnesses in January 2020, because from a surveillance perspective, we also wanted to look at, you know, how does the COVID population compare to flu. And then the other thing that we did is we identified some key data elements that that partners could work on, focus on loading into their data model. So the SARS-CoV-2 test results as those became available, but then other things like ventilator status, were they admitted to an ICU, et cetera. So we came up with those elements, and then some additional guidance on questions that come up when people are trying to load that. And then simultaneously, we'd work to develop a query that would be reissued weekly. And we just keep running it across the network, and so we'll see how it progresses. But then the other thing is it's not a fixed start date, so sites can join sort of once they're ready, and this is a wave approach that people can follow. And so I'm not going to drill into a lot of the results here. There's just sort of a high level to show the progression of the query. And so, you know, we started this at the end of March with some initial testing up to 28 sites. In April, we were largely limited to diagnostic codes only for the case definition. So did the code exist? And then we looked at whether or not, you know, did a lab, was there a diagnosis code, and then did a lab exist? And so you can see some of the results there. In May, we were able to add a lab-based test definition. And so you can see that there's a bit of a difference between COVID based on diagnosis and COVID based on lab results. And again, there's some various reasons why that might occur. We then, you know, began to separate based on care setting, started to look at Kawasaki's and toxic shocks because of sort of cases that we were learning about with the multi-system inflammatory syndrome in children, or MISC. And then sort of our final query in this initial go around was to look at the separation of children and adults when it comes to COVID, and then also looking at ethnicity as a differentiating factor as we, you know, again, hear more and more about the disparities based on race and ethnicity. So, you know, in terms of summary and next steps, so we were able to kind of rapidly create a parallel infrastructure within the network. I think there's been a lot of discussion around sort of next steps and what does that look like now that we've created this. And so, you know, PCORI, which is the primary funder of PCORnet, being focused on patient-centered outcomes research, you know, is wanting us to transition a bit from surveillance to more towards comparative effectiveness research. And so the initial use cases, at least to start, looking at coagulopathy, and so clotting and thrombosis events that are occurring in patients, and so wanting to understand a little bit more around that and what's driving it. And then again, as I mentioned, the MISC in children. And then the other thing that's very important, I think, is data validation. So just understanding a bit more around, you know, case definitions, and when we say that somebody's on a ventilator or admitted to an ICU, you know, how sort of accurate are those flags because of some of the concern that's arisen from data sets like Surgisphere, where they had to retract papers from the Lancet and the New England Journal of Medicine because they couldn't verify the data. So I think that's a key interest going forward. And then, you know, developing relationships with other stakeholders to better leverage PCORnet to help answer those questions. So CDC, FDA, Reagan-Udall Foundation are just a few. I think that's all that I have. So Shelley, I can turn it back over to you.
Thank you very much. This is so interesting. I think we only have time for a single question, and this comes from the Q&A. There seems to be a dearth of PCORnet sites in the western part of the US. Why is that? And what does that do for generalizability of the data?
Yeah, so that is something that we, you know, so the reason that some of that is historical, where in sort of earlier iterations of PCORnet, there was actually a network that was all in California, and then and then some of the Kaisers in the western states as well, and they just over time chose not to continue forward with the network. And so, you know, I think in the western part, we're left with OCHIN, which is, again, a lot of federally qualified health centers. So it's a big organization, but, you know, geographically, it's still somewhat constrained. So it is something that we do look at, and you know, as we go forward with some of these analyses, you know, there's what we can do within PCORnet, and then there's always opportunities to bring on other sites as well. But it is a good question.
Thank you very much. And I see some other interest in the Q&A. So we'd invite people to add to this as they're interested and have questions. Thank you very much.